For me, osteopathic manipulative medicine, it's really a system of hands-on diagnosis and treatment that's an extension of our traditional medical training.
So it's really helping put things back into place to help the body function better as a unit and to allow the patient to heal faster, which is the ultimate goal of patient care.
The idea of using our hands to touch the patient and touch the patient in a way to diagnose and treat.
You know, the body is laid out anatomically in a very certain way. Everyone pretty much has the same anatomy, and if anything goes wrong in the stream of things, it can really affect the person's health or ability to move around in space and really affect their overall well-being.
OMM to me is not only understanding the illness beyond the biology, but it's also providing relief to the patient by the simple touch.
What we look for in the body, we kind of say we look for 4 things, which are tenderness in areas, asymmetry, restricted motion, and just changes in the tissue texture, whether it's joints that feel maybe a little swollen or inflamed or muscles that are tight. And we look for these areas around the bodies, and additionally the ways that people compensate for these specific dysfunctions.
If someone has a back pain, not too long after that, they will develop a knee pain. And oftentimes they will ask me why. And the reason why is because the body is interconnected.
What we look to do is balance these out, get their pain down, get their tenderness down, so that they're able to function more optimally. Because we believe when we get the body and the person to function more optimally, they're able to heal better long-term and empower the patient to do things on their own in the future that help them maintain their health. The biggest thing that surprised me about OMM before I got really involved and learned is how gentle some of the techniques can be and how big of an effect those gentle techniques can have. There are techniques that we can do that really seem like to the patient that we're not doing much of anything, but it ends up having a big effect down the road.
So a common misconception about OMM is, oh, it can't help me, or it's going to take too long, to do it. And that's not the case, because many OMM techniques take 90 seconds to do, a couple of minutes, and it helps the patient.
The patients overwhelmingly react very positively to OMM, whether that's what they were coming for specifically, or if it's something that you introduce that's new to them and they agree for you to treat them. They are very, very grateful because it always provides relief, and the physical touch that you're providing these patients, it shows that you care.
I think is such a great way to just connect with your patients, and really also it helps them in all aspects of their health. So not just whatever musculoskeletal complaint that they're coming in with, but also a lot of other issues that we can kind of treat with OMT.
No OMM treatment is complete until you give the patient recommendations on what to do afterwards. Because when you have patients coming in and you treat them, sure, you'll treat them, you may fix a dysfunction, but if they go right back to their normal habits, they're gonna come right back to you with the same exact things, and it's just gonna be a continuous cycle, which is not the goal. Because the goal is to get patients better and eventually not need you anymore.
I always knew that I wanted to practice OMM because I got the opportunity as an undergrad to actually observe a DO who practiced OMT. And after seeing her work, I really was inspired to continue learning the profession, and I felt it was really good at just connecting with your patients and also giving the patient a complete picture of health and treatment.
I first became passionate about OMM when I was shadowing a doctor in undergrad. While I was in the office, he would be doing some of the techniques like muscle, energy techniques, and myofascial release. And there was a particular patient that was frustrated because he was running behind. And when I saw him doing OMM, the patient went from being frustrated and mad and wanting to leave the office to, I feel better, please schedule me for the next visit. When can I come back? And that caught my eye. And since then, I told myself, hey, if this person could come in and feel better after 5 minutes of treatment, I could do the same thing. I could be the one, treating this person. And that's the best thing I ever decided to. So.